Hello everyone, I'm Renee Mehrra and welcome to Your Health Matters, an innovative series with healthcare experts providing their deep insights into critical public health issues so we can maintain good health. I'm here at CarePoint Health, which is the largest healthcare provider in Hudson County, catering to one of the largest ethnically diverse populations in the whole country. And I'm at the Bayonne Medical Center, and there are two more facilities. It's Christ Hospital in Jersey City and Hoboken University Medical Center in Hoboken. And I'm talking to CarePoint Health physicians. Let me introduce our esteemed panel, which is Dr. Tucker Woods, Chief Medical Officer, CarePoint Health, Christ Hospital in Jersey City. Dr. Ramila Devi Patel, board-certified primary care physician in CarePoint Health. Dr. Gautami Rao, board-certified neurologist and system director of epilepsy, CarePoint Health. Thank you so much for joining us. Dr. Tucker Woods, CarePoint Health is known for its commitment and dedication to its patients, its patient-centric care. Give us a snapshot about CarePoint Health.
Sure. So we're a three-hospital system. We have Bayonne Medical Center here in Bayonne. We have Christ Hospital, which is in Jersey City, and we also have Hoboken University Medical Center. We're the largest healthcare provider in Hudson County, and in my opinion, we're the best. We really provide a lot of innovation. We provide a wide range of care, many specialties. We provide, we have neurology, pediatrics, internal medicine, oncology, detox, behavioral health, and many other specialties. So we really can take care of the whole patient. And by being in a system, we have some strengths. So if there's something we can't take care of at one hospital, we can direct that patient to our sister hospital. So we use the three hospitals as a source of strength, and we're doing a great job.
So Dr. Woods, tell us what makes CarePoint unique. What are some of its strengths?
Sure. So some of our strengths are that we provide excellent clinical care. And I believe in the product. So if I were a patient myself, I would feel very comfortable coming to our system. And I'll just give a few examples. So one thing that we're very strong in providing care with is sepsis. So sepsis is a major killer in the United States. It's an infection that takes over the body. It overwhelms the body. And there's about 275,000 deaths per year because of sepsis. And we're very strong at recognizing sepsis right away, treating it with antibiotics right away, fluids right away. And we have some of the best sepsis scores in the country at all three hospitals compared to the New Jersey state average, compared to the national average. So it's something we're making a big difference, and we're literally saving lives. We also have a reputation for being strong in the fight against the opioid epidemic. As you know, there's a huge opioid epidemic in the country, and we've been really innovative and leaders, not followers, in that area. For example, our three emergency departments, they were the second emergency departments in the country that created an alternative to opioid program, and we call it STOP. It's called Shifting the Opioid Paradigm. And so if you come to the emergency departments at CarePoint Health, instead of getting these addictive medications to treat pain, we actually give alternatives they're non-addictive, and they actually treat these your painful conditions better. So if you came in with a kidney stone, some hospitals, they might give you an opioid, but instead we'll give you something different. We'll give you an IV.
Which is less addictive.
Yes, we'll give an IV anti-inflammatory drug, plus something called lidocaine. You normally get it at the dentist when they numb your mouth, but it actually numbs that pain. We also use, we call it laughing gas. It's nitrous oxide, and that's another form of pain medication. It wears off in seconds. So we've really paved the way in terms of addressing the opioid epidemic. There's even an opioid called hydromorphone that we've actually removed from our three emergency department medication rooms because our alternatives are working so much better. So it's something we're really proud of. Another area where we're innovative is in the field of telemedicine. So for example, if you go to a CarePoint Health facility, after you're discharged from the emergency room, a couple days later you actually will get a video visit. So we don't stop your care after you leave the hospital. We will actually check up on the patient a couple days later, and we can do a video visit from the comfort of your home, or if you're at your job, you don't have to actually come and commute to to the hospital. So we're doing some great things. We're very good in the area of neurology. We have some excellent neurologists and interventional neurologists, and that's another area where we're using innovation. So we're providing excellent care for our community. It's something we're very proud of.
And you have a large segment of the South Asian as well that comes to your hospitals.
That is correct. So in Hudson County, we have one of the most ethnically diverse communities in the whole country. And when you're walking through the hospital, sometimes you'll hear different languages spoken, and that's a reflection of how diverse we are. And so we do have a large number of patients that come to us from the Southeast Asian community. And many of our doctors, too, are from that community. And so there's a real comfort level when you come here.
You see, the patient is also South Asian, the doctors are South Asian, so that comfort zone really bounds the patient and the doctor.
Absolutely. And then what's nice, too, is if a patient does come and the doctor or nurse working that day doesn't speak their language, we're very innovative with our interpretive services.
In demand, right?
Yes, we have a product, it's called Video Interpretive Services, and we'll wheel it to the patient's bedside, and there'll be a video screen, so we can have a female or male interpreter that speaks the patient's language, and it's almost they have a familiar face when they see that face on the screen, because a lot of hospitals will simply use telephones to interpret, but we were very innovative going this next level. And if a patient uses sign language, we can also use the same device to sign. So we think it's very important. We have excellent communication with our patients, and so this is making a big difference both in the office setting, up on the inpatient units. It's very helpful. Everyone really enjoys it.
Dr. Meela Devi Patel, you're a primary care physician, and primary care is the front line, contact between the patient and the clinicians. So it is important that patients understand that the importance of primary care, the rapport, the communication between a primary care physician and the patient. Share from the medical perspective, why is it so important?
I think it's very important for every adult patient to have a primary care physician whom they can call their own personal physician for life. Important that they are comfortable with their primary care physician with whom they build up a rapport. It's your go-to doctor when you are ill, and it makes it easier to get access for that care instead of going to the emergency room or urgent center, which is more costly. It also allows you, building this relationship also helps your physician to know you very well. And over a period of time, that makes it easier for the physician to pick up on any illnesses that, and helps the physician to diagnose that illness much earlier in your care. Also, having a primary care physician, I think, is important because when you develop this relationship, you feel comfortable with the person, and you develop that trust. And sometimes you may not even speak to your family member regarding your problems, but you will open up in front of your physician to discuss some personal matters. And I think for that reason, having a primary care physician is very important.
So hold your thoughts, Dr. Patel. We'll be back after a short break, and when we're back after this break, we're going to talk to Dr. Patel about the preventive screenings and the importance and reinforcing the importance of primary care. Stay with us. We're back and talking to CarePoint Health physicians. And Dr. Patel, we talked about the importance of primary care and the trust and the rapport that is so very important between the primary care physician and the patient. Tell us the preventive screenings that are so very important that a primary care can talk to the patient so that we can detect early on any chronic illnesses or communicable diseases.
Yeah, that is so important. Patients usually visit their doctor only when they are ill, and they don't realize that there is some sort of a maintenance required. Like your car needs to go to the mechanic for maintenance, for it to run properly. So the preventive screening is very important. It allows us to detect illnesses in the earlier stage, and when it's easier to treat, easier to cure before the disease progression occurs and complication occurs. The second thing is the cancer screening, which is the most important, and as you know, cancer rates are increasing. And the most important thing, mammogram, colonoscopy. These tests are wonderful at detecting cancer in the precancerous state, in the early stage where you can actually be cured and prevent the long-term morbidity and mortality that's associated with this terrible illness. So apart from cancer screening, also every patient must go through preventive care to detect early diagnosis, because early diabetes, because diabetes can be a silent illness. Hypertension could be silent. You may not know till hell breaks loose and you get a stroke.
And South Asians have a high prevalence of diabetes and cardiovascular disease.
So when you go for your annual physical and the doctor determines that you have a high pressure, or your screening test shows high cholesterol, high diabetes, these risk factors, that they can intervene early to modify these risk factors and treat it and control it in the early stages. So apart from cancer screening, diagnosis of chronic illnesses, and the other screenings are in men, prostate screening, especially patients when they present with symptoms, or starting age 45, all men should go through prostate screening earlier if they have symptoms or their family history or risk factors. Elderly patients, very important for screening for the human, to make sure that screening of osteoporosis, the risk of fall and resulting in fracture, that causes a lot of disability in the elderly. So I think preventative screening and preventative annual physical is very important.
So is it annual, or should we say every 4 months?
Well, you provide screening at every visit to your doctor, okay? You don't wait for a year to do that. I do that for my patient. Every visit, even if they come for a cold, I quickly screen for age-appropriate screening testing as per guidelines. So yes, that we do. It has to be every visit, but if many patients, as you know, younger patients, when they're healthy, they don't come to the doctor. And what I'm trying to stress here, patients think, oh, I'm feeling fine, and they don't go to the doctor. And so they need to make an annual physical. And for patients with chronic illness, they do visit the doctor regularly to monitor their chronic medical problems. And at that visit, the doctor is constantly monitoring these patients.
Dr. Woods, Dr. Patel was talking about screenings and how important it is for early detection. So how do you promote these screenings and health education, especially in vulnerable communities?
Sure, so that's an excellent question. So if you don't go to your doctor, what's unique about CarePoint is we will go to you. We have a mobile medical van, and it's very active. They're screening for cancer, they screen for cholesterol, diabetes, they'll do a blood pressure check. And one of the things that's important to CarePoint Health is population health. We want to improve the outcomes of a community, and this is one of the ways we do it.
So can you share with the viewers what population health really means?
Sure. With population health, you're trying to improve the health outcomes of a community. So our community is Hudson County, for example. And so we will push that mobile medical van out into the community, and we want to catch these different diseases in their tracks before they start or early on in the process, whether it be diabetes, high cholesterol, high blood pressure, certain cancers. And so we're making a big difference with this mobile medical van.
And do they speak in different languages?
Yes, so we have a very diverse community. So in our mobile medical van, we have diverse staff that are in that van. It's very important.
That is interesting. And I believe that you have like almost 30 to 50 events in a month?
Correct. We have many events. We'll hold, for example, we have a mammogram-a-thon where we'll offer mammograms for the community. We have these events called Lunch and Learns. We'll invite the community into our hospitals, and we'll teach on a certain topic. We might teach about stroke today. We might teach on diabetes the next month, colon cancer the next month. And screenings are important, as Dr. Patel pointed out. In our mobile medical van, we actually did 14,000 screenings last year. So that gives you a sense of the scope of how busy they are.
Tell us on a tangential note about cardiovascular conditions. We're talking about screenings, we're talking mobile medical vans. You know, primary care is so important to look at the cardiovascular conditions, especially in minority communities or where there's a genetic predisposition to cardiovascular disease.
Yeah, that's very important. You only get one heart, so you have to take good care of it. So when you go to your primary care physician, they're going to do an annual EKG to make sure your heart is okay. Blood pressure, it's sometimes called the silent killer, so they'll check your blood pressure. And if you're reporting any symptoms to your doctor that are suspicious that they're cardiac in nature, sometimes they'll send you for something called a stress test or an echocardiogram. But your cardiovascular health is extremely important.
A stress test is for what age group?
It can be any age, but traditionally it's usually patients, they tend to be over 40, over 50 in age, but it can be really any age. But your cardiovascular health is very important.
So what are the symptoms like when you're looking at for a stress test? Who qualifies for it?
Sure, so patients, they might report to their doctor that they're having shortness of breath when they lay flat, or if they climb one set of stairs, they're developing shortness of breath, or maybe some chest pain with exertion. And those are warning signs for your physician to maybe dig a little deeper. Maybe we have to do a certain test.
Right. When we come back, we're going to be talking to Dr. Gautami Rao about the early signs of stroke, right after these messages. Welcome back to Your Health Matters, and now we're talking to Dr. Gautami Rao. Dr. Rao, tell us the early signs, that we should look out for stroke, because I believe 1.9 million brain cells die every minute. So that is so important for people to understand the early signs so that help could be on the way and medical help could be given to that patient.
That's absolutely right. It's 1.9 million neurons for every minute that the brain doesn't have blood supply. And that's what a stroke is. There is a part of the brain which loses blood supply either because of a clot or because of blood. And there are some strokes too that can be caused by high blood pressure that are neither of these two, and those also cause a lot of symptoms. And one of the most common symptoms is when your face becomes droopy, or if you can't speak, if you can't find the words. You may feel that after a couple of minutes you can find the words, but just the fact that you had that initial symptom is important. Sometimes it goes away, which we call a transient ischemic attack, and then very often it stays. And then you can also have weakness of your arm or your leg or both. Obviously, there's the bigger strokes where you have all these things affected, but those are the major signs. Another really subtle type of stroke is one in the back of the brain, the cerebellum, where people just present with dizziness or a fall. And afterwards, when they get up, they can't see out of one part of their, one eye or the other, and their face is drooping. So if you see any of these symptoms, it's really important that you come to the hospital, especially a stroke center like ours in the CarePoint system. All 3 hospitals are stroke centers, and we're becoming a comprehensive stroke center as well, within 6 hours. We prefer if you come in right away, but obviously sometimes it's not possible. If you come in within 3 hours, 4.5 hours, I'm sorry, we have a clot buster. So we can actually remote in from our laptops, either me or my partner or the other neurologist on call, into the emergency room immediately. We can take a look at you, or usually we're physically there, diagnose you and get everything done. We have a 1-hour limit where we get all the tests done, and we give you the clot buster immediately afterwards. And we've had many cases where this has reversed the symptoms.
So what are some of the risk factors for a person who may be susceptible to stroke?
It was just like Dr. Patel was saying. They're the silent ones. Diabetes, which is very common in our South Asian population. I know I have it in my family. Everybody has it, except for me so far. High blood pressure, high cholesterol. Age is also a risk factor as well, although we're seeing a lot of 40-year-olds and 50-year-olds with strokes. There's definitely a correlation with stress, although we're not really sure what that correlation is. weight. These are all modifiable risk factors, and which is why I'm really happy that Dr. Patel emphasized that a person is like a car, you have to maintain it. And especially if we have it in our family history, it's modifiable. If you go and you take care of yourself and you watch your diet and you exercise, there is a very high chance that you will be able to prevent these diseases.
Diet plays a very big role.
Yes, absolutely.
And especially with South Asian diet, at times, we eat a lot of carbs. So what do you tell your patients, about the dietary intake and the nutrition aspect?
Well, Indian diet is, as you said, carbohydrate rich. And unfortunately, a lot of patients, Indian patients, are vegetarian too. So I do tell the patients that if they must eat carbs, they have to select the type of carbs they eat. There are different types of carbs, the simple carbs and the complex, and they should improve their awareness on the type of carbs they eat. Understand which are complex carbs, the grains, the whole grains. Indian diet is full of whole grains. And also they must familiarize themselves with which are the diet that is rich in protein, the Indian diet that's rich in protein, so especially when they're vegetarian.
Beans,
all the lentils are rich in protein, and they can kill two birds with one stone, get the protein, get the carbohydrates. And also minimize their fat intake, the saturated fat, the trans fat. They have to limit that. They need to stick to high fiber diet, low fat diet, and low carb and high protein diet.
So less
That's
oily
in a
fried
nutshell.
foods, especially if you're
Avoid
diabetic.
avoid the fried foods. Avoid putting ghee.
Yes.
Ghee is the Indian butter that we put on our chapati, our bread.
yeah.
We make the chapati with oil. We put the ghee. So we fry sometimes this bread. So it's very rich in fat.
Like the puris you're
the
talking about.
puris I'm
yes.
talking about, yeah. They're very rich in
I mean,
fat.
they look, they taste delicious,
They
but
taste
then
good.
it's
And,
not
you know,
good for the heart.
And Indian curry is floating in oil many times because the more the oil, the tastier it is. Isn't that correct?
So, as I said before, we have all these risk factors in my family. My dad died suddenly from diabetes and a heart attack because he refused to stop eating rice, literally. And he was a physician. So I'm very conscious of this, and I've developed a way of making Indian food which doesn't have as much fat in it because I use Pam, I use fat-free milk, I don't eat my, I'm not vegetarian, but I don't eat my meat curries and my vegetable curries on rice. I eat it on lettuce or salad. Which is weird and is not as much fun, but I have to do that and I can do all of this, and I will probably still develop all those things because that's genetics. Everyone says, well, how come, Japanese and Chinese people eat so much rice and they're fine? We don't know. We don't know why they're fine, but we're not. So I think that unfortunately, we have to respect what our genetics have and realize that it's modifiable. Of course, you can eat your puri and your dosa and all the fried food once in a while, but the problem is that I think a lot of South Asian people feel that it's an inevitable thing that you're going to develop these diseases, and it really isn't.
Right.
And once you develop it, you can still change it
Exactly.
through exercise.
And I think that's where the primary care physician comes
Absolutely.
in.
Well, we talk about it too.
Yep.
I talk about it with my patients too. If I have an overweight patient, I definitely say, you can change this. You can do exercise. Exercise is so important for Indian people. We have a lot of heart disease. There were many studies done that we have a genetic predisposition to smaller intracardiac circulation. We have certain things that we are prone to. So exercise is extremely important for us. And it can be done, and I always tell my patients, start slow with a walk, work your way up. There's, and for people who really are, hundreds of pounds overweight, there's always gastric bypass surgery. So these are all important things, and we try to emphasize that because we don't want to see you in the hospital with a stroke.
Absolutely. So physical activity, exercise, diet, very, very important. And Dr. Woods, you want to give your final thoughts?
Sure. Just to close off on what they've been saying, you only have one body. You have to listen to your body and take care of your body. If you have symptoms, don't ignore them. It could be something serious. You need to go to the doctor. But there's some silent killers out there as well. So even if you're not having symptoms, it's important that you see your primary care physician on a regular basis.
Yeah, they shouldn't feel embarrassed for any symptom that they're going to talk about. Oh my God,
Absolutely.
what's the doctor's going to say about this?
Yes, absolutely.
Yeah. So the final takeaway is be in touch with your primary care physician on a regular basis and visit the primary care physician on a regular basis. So very important to detect early signs of any chronic illness or any communicable disease so that you're on the right track. Physical activity, exercise, very, very important. So be in touch with your primary care because your health matters. Thank you very much, Dr. Woods, Dr. Patel, and Dr. Rao. And keep watching Your Health Matters. Stay healthy, stay positive. I'm Renee Mehrra.